Hello, my name is Leslie Wallen. I'm an occupational therapist, and today I'm sharing techniques for hand wrapping. And these techniques are particularly helpful for children with epidermolysis bullosa, as well as other congenital hand conditions. So the first thing I'd like you to notice is that this hand is already partially dressed with a thin foam dressing. I've secured one piece around the wrist, and I've also placed a dressing for two fingers that are side by side. Now you can find the technique of how to do this in the video with finger wrapping with a red bandage to see how we do this. Now what I'm going to do, just so you can see what that looks like, just turn the hand over. Now what I am going to do is add one thin foam layer. If you needed to just dress one individual finger, this is how you would do it. Now I want to go back one step because it is really important to be prepared prior to starting any dressing wrapping on your child. So make sure that you have all of your dressings and wound products organized before you start. So in order to add one finger, in order to dress one finger, you're going to take your thin foam layer, you're going to put it on the base of the finger. Okay, and I'm going to do the ring finger for demonstration purposes today. So I'm securing that to the base of the ring finger, just at the bottom of the finger there. And what I'm doing is just draping that down the back of the finger. Now, one of the nice things is if you're dressing an individual finger, with your dressing, you can actually just try and stretch your finger just gently up while you're placing your dressing down. And you really want to make sure that your dressing is long enough to be anchored onto the piece at the wrist. And this really just helps prevent any motion or movement of the dressing on your child's hand. So that's what that looks like. So as you can see, we've anchored it down on the wrist, and it's starting just at the base of the finger. Now what you can do is make your dressing a little bit wider than the one I have here. And when you start wrapping with your soft wraps, what you'll find is that that dressing actually closes around the sides of the finger. So let's start with wrapping. So the wrapping technique I'm sharing today is actually for wrapping in between each of the web spaces as well as up each of the fingers. So to start, what I'd like you to do is start with the roll on the top. So we're going to start by securing that on the little finger side with our hands, and we're always going to be wrapping towards the thumb. So making sure you're not stretching the bandage too much, you just want to lay it down very gently. And you're going to secure it once around the wrist. Okay, and when you're done doing that first wrap around the wrist, we're going to start by wrapping the thumb. So you're going to come up and through the thumb web space and just very gently lying that down in the web space and continuing to wrap around the thumb. Okay, so let's have a look at how that looks. So we've just gone up and around the thumb and we've secured that once in place. Now, once you've secured that in place, the first thing we're going to do is wrap the web spaces. So you're going to come around and turn your hand over, and you're going to hold your dressing, your nice soft wrap, just in the palm of the hand, and you're going to gently bring that through the web space. Okay, turning the hand over and just holding in the palm again. You can just swap hands there. You're just going to bring that down to the wrist and continue wrapping. Now you're going to bring that around the wrist once, turn your hand over, and you're going to do the second web space. Now dressing the hand like this helps in two ways. The first is by providing some light pressure into the web spaces to try and prevent those web spaces creeping up. The second is by wrapping each individual finger. And by doing so, we can try and keep the fingers as open as possible. Okay, so around we go again through the web spaces. Now that's the web spaces done. So we've secured our dressing around the wrist. Every day is going to be different. And sometimes children are really going to struggle through this process. And if you find that your child is very wiggly and it's really not working, it is absolutely okay to stop. So what you can do, the first option you have is actually to just clip your bandage, put a bit of tape on there wherever you're up to, and give your child a break. And when things are a little bit calmer, you can come back and you can finish your wrapping of the hand. The second option is if things are really not going on well and it's very difficult, if you're feeling overwhelmed or your child is just really struggling through the process, it's absolutely okay just to stop, take things off, regroup, get all of your products prepared again and have another go, okay? That's absolutely okay. And the third is if you have some help in the home, it might be that your partner or if you have a friend or family member over with you, to maybe come over while you just hold the bandage and while you hold your child's hand. You have an opportunity to just engage with your child, try and calm them, or in fact call someone else over who might be able to give the child a bottle, talk to the child, sing a song to the child. Just find a way of calming your child, regrouping, and then you can just carry on where you are, just by holding the dressing as you are and holding the hand. Okay, so I'm going to carry on now, and I'm going to wrap each finger individually. We're actually going to start at the thumb. So much like we did at the very beginning of the dressings, we're actually going to come around the outside of the thumb through the web space, and we're going to just slowly start covering up the thumb. Okay, and this is just giving a level of protection to each of the fingers. Okay, so here we go. Now we're going to do this wrapping from the back of the hand. We're going to come through that web space again, but this time we're going to go around the index finger. And for demonstration purposes, I'm just going to add one wrap to each finger, but you can absolutely go all the way up to the tip of the finger as you need. Okay, now the importance of this step is that with the little bit of stretch in our bandage, we can actually try and just pull the fingers open and back away from the palm. Okay, you're going to lay your bandage very gently at the back. Okay, holding it there at the wrist, securing it down, and we're going to start with go back to the thumb side of the finger, slowly through the web space. And again, trying to keep your dressing just as flat as you can, okay? Sometimes you'll just need to come and have a little peek inside here and make sure that your dressing is flat. Okay, if not, come back out. Just try and get that nice and flat. Best you can. Round once. Okay, so as you can see, my little bandage is getting to the end. So what I'll do is I'll just bring that down the wrist, very gently lay that down, take a little piece of tape and secure that in place. Okay, so that's where I'm up to. Once you've anchored at the wrist, if you've finished one roll of bandage, you're just going to take your next roll in the very same position. So with the roll on top, I'm going to secure it once around the wrist, and then I'm going to start wrapping the ring finger. So starting on the thumb side of the finger, pull it through the web space and very gently rolling around the finger. And again, you can come up as high as you need. And what you can do is if your child's fingers are slightly bent, with your dressings, you can try and just extend the finger gently, just by holding on to along the length of the finger. You can hold on to the finger and try and just give it a little bit of a stretch up as you're laying your bandage down. Wrapping around towards the thumb, we're going to do the same to our little finger. And again, just wrapping around your little finger, just making sure you're trying to keep your dressing as flat as possible, or your wrap as flat as possible. Okay, so once you're done with that part of your wrap, and I'll just show you. So what I'm going to do now is I'm going to bring it up through the thumb and the index finger web space. And what I'm doing now is I'm going to provide a few layers of protection to the palm. So just by wrapping it gently round the palm, and I'm going to do that again. I'm just going to come up, okay, and go through that web space again. I'm just adding some layers to provide protection to the palm, and you can add as many layers as you need. And then once that's complete, you're going to trim your bandage. Add a little piece of tape. To secure that in place.